Good morning, good afternoon, good evening, good day, everybody. Thanks for joining us for our next this Asia PGI webinar, focusing on wastewater environmental surveillance. It's a great opportunity for us to be here to share as well as to listen to some of the case studies from our country partners and colleagues who have experience in establishing national wastewater surveillance as part of their overall national collaborative surveillance systems. Before I formally introduce our guest speaker, Dr. Afreenish Amir from National Institute of Health, Pakistan, please allow me to spend about 5 minutes to quickly introduce Asia Pathogen Genomic Initiative that looks into wastewater and environmental surveillance in Duke-NUS Medical School, the Center for Outbreak Preparedness. My name is Vincent, and the lead for the wastewater and environmental surveillance for Asia PGI and Center for Outbreak Preparedness. So we aim to collaborate as well as to support country partners in advancing wastewater environmental surveillance through implementation with multiple pathogen approaches in Asia. So we have recently launched our webpage, where you can find a number of key activities that we have co-organized with global actors like WHO, as well as partners in the countries to engage stakeholders on advancing wastewater environmental surveillance. And you can scan the QR code on the left bottom corner to find out more about what we do and how we are engaging the different stakeholders. We always focus on these key considerations in the form of a pyramid to advance wastewater environmental surveillance implementations, especially when we engage our stakeholders. We would like them to ask themselves the question of the public health questions that they would like to invest and build their national wastewater surveillance program for, to help to reduce public health risks, especially. And in addition, what will be the potential actions that will be available that will be able to quickly respond to the insights that's going to be provided by the wastewater surveillance, so as to even further justify the investment of wastewater surveillance for public health and reduction of infectious disease burden. And of course, primarily, there will be a need to understand the sampling sites, where the understanding and the mapping of sewage infrastructures will be critical to design cost-effective strategies to survey as much of the population as possible, especially in populations where healthcare accessibility is a challenge, and especially where public health measures, for example, vaccination programs, can be also a challenge. So we also supported country partners to look at their laboratory infrastructures. Are they able to currently detect pathogens of public health importance, especially the vaccine-preventable ones? And would there be any sustainability plans which very much will help us to justify with the use of national budgets to sustain and the continuous use of wastewater surveillance for their populations, for their public health? So we have also conducted a review of the current pathogens that have been detected by wastewater surveillance that also allows public health authorities to act on with different public health measures, such as pathogens that are vaccine preventables, drug treatables, vector controls, and potentially the need to enhance control with non-pharmaceutical measures, and of course, in considerations of the emergence of some of these pandemic novel pathogens. Asia PGI Wastewater Surveillance Initiative has also created this regional Asia dashboard map to allow country partners who are currently engaged in wastewater surveillance activities, be it in research or in longer-term programs, to provide us a bit more details and clarity on their scope and the characteristics of their wastewater surveillance strategies. And the main aim is to actually to help us and to guide us on how to support them further to sustain wastewater surveillance. So there are already 15 countries contributed to this dashboard with about 87 projects. And you can see more details with this QR code on the left bottom corner of the slides. And based on the current mapping details that we have gathered so far, analysis have been conducted and published in this journal. It has a QR code on the left-hand bottom corner of the slides, where you can find more information and insights about the existing characteristics of wastewater surveillance in Asia. But more importantly, I would like to highlight the priority of needs for implementations. Besides funding and the importance of government support, Asia PGI and Wastewater Surveillance Initiative is looking at how do we actually enhance mechanisms for regional coordination efforts to have better access to laboratory testing resources, especially the more cost-effective ones with multiple pathogen approach. For example, the use of targeted NGS, and whether there's a chance for a regional consensus on data information sharing platforms and agreements, and to new sampling technologies to sustain wastewater surveillance in Asia to enhance regional security. So we're very fortunate that we have the pleasure to have this opportunity to hear from Dr. Afreenish Amir, who is the current project director for AMR in National Institute of Health, Pakistan, part of the US CDC Project. She's a medical microbiologist by training with more than 14 years of experience in clinical microbiology and infectious diseases. And she has been a key player in the implementation of the National Action Plan of One Health Antimicrobial Resistance, Laboratory System, AMR, and AMC surveillance, stewardship, and advocacy, especially in Pakistan. So without further ado, I would like to hand over the time to Afreenish for her presentations to listen about Pakistan's strategies in the national, for designing in the national of wastewater surveillance. Afreenish, please. Thank you.
Thank you so much, Vincent, for the introduction. And it's such a pleasure and to join all your team for this work that we are doing on the wastewater surveillance. So let me share my slides first. And can you see the screen now?
Yes.
Okay, thank you. So I'm going to talk today about the how to develop a national wastewater surveillance strategy. And this is through our experience and through our work that we have done in our country. And also we are doing work with a number of countries in this Asia PGI consortium. And through these experiences, we were just thinking that there's a number of approaches that we should develop, we should understand that to develop a surveillance strategy within a country. And this presentation is going to include some of the key characteristics whenever we are developing a surveillance system, and that should be considered. The second part will include how to go to a stepwise approach towards developing a strategy. And finally, we will definitely look into the details of the components of the national wastewater surveillance strategy. So to begin with, what are the characteristics of a national wastewater surveillance system that needs to be considered whenever we are developing a document? First thing first is the system should be flexible enough. The main thing, first thing is that the system should have the capacity that it can monitor multiple pathogens simultaneously, because we are dealing with a wastewater, which is a complex of number of the pathogens, and the system should have the capacity, whatever we are thinking on the lab side, on the public health aspect, on the communication side, it should be able to monitor number of pathogens. Again, the system should have the capacity that it can adapt to the emerging threats. Wastewater is always a threat multiplier where the different pathogens are there and they are engaging with each other, and we can see that they can emerge resistance, and they can emerge into a number of the serious pathogens for the human health. So the system should be able to adapt to the emerging threats. Again, the system should have a large scalability in terms of the sampling frequency, in terms of these sampling sites, and in terms of the crisis, like in the times of the outbreaks. Secondly, the system should be equitable. We should always consider that what should be our coverage area. If we are talking about the urban area or the rural area, sewered area or the unsewered area, and it can be a stepwise approach that how should we go towards development of this coverage. At times, there is a very robust system that can include all the relevant areas in one go. Otherwise, you can go in a stepwise approach to develop this kind of a system. Similarly, another important area is that system should be able to address the disparities, if we're talking about the vulnerable areas or in case of any crisis or in case of any damage to the vulnerable population, that should be considered. Next, the system should be sustainable enough. Again, funding is the main element of any system development. You have the right resources in your hands, and you will be able to identify the human resource, the procurement, the system development, and this can only be sustainable if you secure long-term funding. And in this perspective, this is always considered to create advocacy to the policymakers, to the funders, to the donors, to the stakeholders that they should invest in this area and they should understand the importance of this area. The fourth important element is that the system should be integrated. A wastewater system should not be considered as a standalone approach. It should be correlating with the clinical data, with the epidemiological data, with the data from the public health agencies, and all this can be correlated and well understood, can eventually help the community. Whatever the data is generated, whatever the system has been established, it should always be actionable. It should be delivered in time. The data, whatever it is generating, it should be reliable, and data can be interpretable. Always we should think that the data should be talking and should be relating to the public health decisions. Finally, allocating the resources to this particular area, generating the alerts, taking the public health intervention based upon this area. So these are some of the key characteristics that a surveillance system should have, a wastewater surveillance system should have within a country. Whenever you are developing, always think on a broader aspect that what factors should be considered to develop a surveillance system. The second is that what are we going to talk about is the how to develop a surveillance strategy or a system within your country. So it is not different from the other systems that we develop usually within a system. And it always starts with this diagram in which we start with the assessment. Assessment is the first basic step that we have to understand what is the basic current structure for developing a new system within the current system. The second step is to particularly develop the system, execute the activities that we have identified. The third is that we have to engage the stakeholders, optimize and implement the strategy finally. And the most important step is evaluate whatever you have developed. And you can renew, you can revise your strategy based upon your experiences. So our stepwise approach, I'm going to go in the detail in the next slides, that this is through our experiences that we have seen during the time of the COVID-19, during the time of the certain outbreaks that are related to the wastewater in different parts of the country. And through these experiences, we have come to this scenario that there is a stepwise approach to develop a surveillance system. Phase one is the assessment. Always a must necessary thing is that we have to understand that whatever capacities we have with us. First thing first, talking about the wastewater system within the country, that how it is being monitored, what are the stakeholders, what are the institutions, what are the partners which are engaged in these kind of activities. That should be well mapped, that should be well considered. I can give you an example of my country. When we were doing this kind of establishment of a surveillance strategy, we have done a complete kind of a mapping of all the systems that are related to wastewater within the country. We try to identify their work, their objectives, their TORs, and then we have tried to identify the right human resource attached with this kind of systems, so that whenever we are developing a new system, we should always engage them in the consultative process for the documents. Second is current surveillance inventory. So I just mentioned to you that wastewater is not a standalone approach. It should be integrated with the laboratory systems. It should be integrated with the clinical management systems. public health intervention, vaccine strategy, vaccine management system. So there are different surveillance structures already happening within the country. So the wastewater should be, we should understand what is happening within the country and how well we can integrate the wastewater surveillance system with the current surveillance inventories. Human resource, as mentioned to you, is not only limited to the wastewater system, but also included the laboratory system, because wastewater requires metagenomics, sequencing, public health interventions. So there are a number of areas that can be considered from the human resource side. Information system, that whatever the data being generated, how the data is being captured within the country right now, and as this is an integrated system, that needs to be well understood, and how best we can place this wastewater data within the existing information systems. Then we have to assess that how well this approach is being received by the political side, by the governance structures, by the leaderships, by the donors, by the stakeholders, and how well it is being accepted by the public as well, as we are going to have some ethics and the legal aspects that needs to be considered regarding the public aspects. So assessment does not finish over here. When we were doing within our country, it was like an approach that we have to go toward a very comprehensive SWOT analysis. We should understand what are the strengths and the benefits, what are the weaknesses within the system, and what could be the challenges, and what could be the opportunities, and what are the different threats that can be present within a system. This always helps, this complete mapping, consultation, understanding, this always helps to understand that whatever we are establishing, how it is going to be last long, and what other factors can support, strengthen it to sustain it for a longer period of time. So this is just an example of some of the activities that are done by different authors across the globe, trying to show the strengths, benefits, challenges, and limitations. The second phase is to develop. Now it's time that we have to identify our vision, our objectives, our strategic priorities, our stepwise approach to develop the system. You can bring it in a form of a document through a consultative process. Always gather the team, always gather the right people, the stakeholders, to develop this kind of consultative documents. So this is kind of an ownership, and people accept it, and they try to be part of the system as well. The second important thing is that always estimate the cost and the resources that will be required to develop this kind of a system. This is a mandatory in case of the wastewater surveillance. This, in many of our countries, we have seen that it is like the cost is a major barrier in the development of these kind of systems, because the sequencing, metagenomics is a very expensive business. So that always creates a limitation or a barrier for many of the systems to develop. So always give good platform to the people, give them a costing analysis that this can be done like this. Give them the costing solutions in terms of comparative analysis through the different systems. And then they always talk about that all the results, the data that has been generated, it should go towards the public health interventions, and it should be helpful for the public health actions. Just to give you an example that how much this wastewater, the clinical testing and the wastewater testing, how can we correlate the resource requirements for both of the systems. This is a study published, and they were trying to understand that there's a clinical testing on one side in the red bar, and in the upper paragraph, you can see that the wastewater testing. So you can very well see that in the case of clinical testing, in the terms of laboratory equipments and the laboratory assays, there is a high cost that is being involved as compared to the routine wastewater testing. And the impact of the wastewater testing and surveillance is huge as compared to the clinical testing. Then when we can see this, the human resource side. In the terms of the clinical assessment, there are certain areas where huge human resource will be required in terms of clinical staff, clinical laboratory staff. But as compared to the wastewater testing, we require more human resource in the municipal and environmental staff, in the environmental laboratory staff, public health, analyst, and IT staff, bioinformatics people, they are more involved. So just want to give you an understanding, basically towards the cost side, that there's a huge impact between the clinical testing and the wastewater testing, and if we invest more towards the wastewater side. Similarly, another study that has been published, and they were trying to tell about the cost of the wastewater testing and the clinical testing cost per person. In the upper block, you can see that the cost has been calculated for the wastewater testing cost for per person is $0.5 per person per year. But as compared to the clinical testing, the cost would be quite high. It can be $5.80 per person per year. So you can easily do some kind of mapping intervention, help people to understand that how much this can save the cost and how much this can be more beneficial for the public health. Now the third phase is now actually the implementation. Once the strategy, the document has been developed, the goals has been identified, resources has been allocated. The third phase is now you have to implement, and then you have to engage the stakeholders. Either it's the sampling sites or the public health engineering departments or the public health agencies or the data management angles or the laboratory people. You have to engage all the stakeholders, and you have to implement your strategy, and you can optimize the implementation plan while you are actually working with these stakeholders. Always suggested, go with the pilot approach. Wastewater is a newer approach in many of the countries, and it is always suggested to go with the pilot approach, select a few sites, implement your work, see what is the response, what are the challenges, and what is the different factors that are supporting it, what are the different factors which can be a challenge to the system. And then you can improve your practices, and then you can expand or scale up the approach to the different parts. Always talk about the sustainability. We are going to talk in the later slides as well. The final approach is evaluation. This is the thing that we miss many of the times, but for a very robust and a very dynamic system, evaluation is a must, and monitoring and evaluation is always a must. You always have to go back. What is your purpose of the program? Are you able to achieve all the targets? And then you have to understand the data, what has been generated, is it best utilized or not in terms of the public health interventions and public health benefits. Then you have to evaluate that whatever cost has been identified in the beginning of the development of the strategy, are we able to achieve that targets or not? And do we need more stakeholders, and do we need to engage more funders to support the activities? The most important thing is the feasibility, flexibility, and the sustainability. Whenever you are evaluating, you should go back to all the data sets and understand that whatever we have established, is it feasible enough? And it is flexibility, the main characteristics of a surveillance system. Is it able to pick up the pathogens that we are targeting? And is it sustainable enough that it can go along for a longer period of time? Barriers and facilitators always being discussed, that what helped, what didn't help. And then adaptation to the next cycle, adaptation to the scale-up approaches that needs to be considered. And then equity and ethical issues, they are must considered. When we were developing this kind of work, there's a very good discussion with all the different countries that the ethics and the legal issues related to the wastewater surveillance system, they are yet to be developed in many countries. And through our experience, we were able to talk and generate some kind of material to help people to understand the ethical issues that can be related to the wastewater systems. So now coming towards the almost the last part of the talk, what should be a stepwise components that needs to be part of a surveillance strategy? And first is always define your vision, that what needs to be done, what is your overall holistic approach towards this system development. For example, when we were talking about in our country, we were thinking to have a resilient, integrated wastewater surveillance system to strengthen the public health response within Pakistan. Similarly, you can define your own vision based upon your current existing structures, current existing approaches, and overall approach to the control of the diseases. Second is define the objectives, what we call as the strategic objectives, that whatever the system, what are the priorities for the system. For example, some of the priorities for the wastewater surveillance system, it could be detect, monitor the priority pathogens in the wastewater, and then integrate this wastewater surveillance system with the public health surveillance for early outbreak detection and trend monitoring. And then build the national capacity in all the major areas, in the environmental surveillance, in the laboratory system and data analysis, and then promote the One Health collaboration across all the sectors. So based upon your experiences and already existing systems, you can always refine or revise the strategic objectives. Most important is what should be the governance model, what should be the hierarchy that should be looking at this surveillance system, and always suggested to go towards a multi-sectoral collaboration approach. Form a multi-sectoral task force that should include all the relevant authorities like the public health, wastewater authorities, environmental sector, laboratories, academias, and then define their roles and responsibilities, and always try to align it with the existing structures. In Pakistan right now, we have the health security systems, we have the IHR, GHS frameworks, and we have gained a lot of understanding through the joint external evaluation. So we were always trying to correlate whatever new system that we are developing with the existing plans and frameworks that we have within the country. Now, the fourth major thing is that wastewater is something kind of a new that countries need to identify. It's different from the routine AMR surveillance. It's different from the routine integrated surveillance mechanisms. It is different from the routine clinical surveillance systems that are happening. And it is a very costly business as well that needs a particular human resource, particular equipment, particular bioinformatics approach. So always prioritize your work, that what you need to do. And this can be expanded later on, but first thing first, you have to prioritize the pathogens that you need to identify within the wastewater. In many of the countries, there was a huge approach and huge understanding towards the wastewater during the time of the COVID. And since then, it is happening with the COVID as well. Then you can talk about the typhoid, Vibrio cholerae, or the antimicrobial resistant genes, depending upon your own consultative processes and consultative discussions. Again, prioritize where do you want to work actually. It can be either the urban areas or the rural areas. It can be informal settlements. It can be a high burden hospital. So you should identify and prioritize, because in the beginning, there will be a challenge of the cost. There will be a challenge of the human resource, the bioinformatics, expertise. So always go with the certain prioritization so that you achieve some of the results, and that can generate a good background to develop more areas, to engage more areas. Then environmental targets should be identified. It can be sewage system, it can be open drains, it can be wastewater treatment plants. Next important part of the surveillance infrastructure is that it is not a standalone approach. It always depends upon the sentinel site network. It can be the laboratories, it can be sampling sites, it can be your public health engineering departments, it can be your filtration systems. So the sentinel site network plays a very key role. So always select your sentinel sites based upon the population coverage, accessibility, and epidemiological relevance. And it is always suggested to go with the easier approach. Either you can start with the urban sentinel sites that can have a very good mapped catchment population and the population coverage data available. So this always helps, but you can always go based upon your own preferences. Always leverage on the existing environmental surveillance infrastructures. In our country right now, there are different infrastructures which are already happening, and we always talk to them, learn from their experiences. And it's not a standalone approach, so we try to engage them in the development process and always engage with them in terms of their expertise. Then exactly. The important thing is that whenever this wastewater surveillance sampling strategy, you have to identify the sampling protocols and the logistics. And this is not just that you can take the model from any other part of the country and you can adapt to it. You always have to customize it according to your own needs, according to your own approaches. Sampling methods, they can vary. When we were developing within our country, we were doing a number of approaches. It can be a grab, composite method, it can be a passive sampling. And based on our experiences, we have identified some of the approaches that suits best our community and that suits best our sampling techniques and the availability of the laboratory supplies. Then you have to identify the sampling frequency. Initially, it can be based on the weekly basis or a monthly basis, but depending on the burden of the disease, it can go towards a daily sampling frequency. The basic measures that needs to be considered, the sample transport mechanisms that needs to be identified, biosafety measures while handling the samples, and while they are in the lab, that needs to be considered. In my team, and we always suggest to write with the SOPs, the guidelines, so that there should be a very robust and clean system, whoever wants to work in the wastewater system for the sustainability purposes. Laboratory capacity building. It's a new area in many of the countries. Sequencing is already happening, but again, metagenomics is a little different area, and that needs to be understood. Identify and equip the reference laboratories. Train the staff in the molecular diagnostics. So it's not just one approach that needs to be trained upon. It's not only metagenomics. We were just talking about the RT-PCR approaches, or the shotgun, or the TACMAN assays, just to identify that what suits are best and what is the best cost-effective solution. So you have to train your laboratory personnel based upon these approaches. Side by side, try to develop a quality assurance system and biosafety protocols. The next important component of the strategy is that you have to develop a data management system, and it's whatever being generated from the laboratories, that needs to be well translated in a very easier and a very understandable language for the policymakers. So from the beginning to the end user, you need to identify a data management system, and this can be linked to the already existing epidemiological surveillance system, and use the geospatial tools, trend analysis to interpret the data. And this data should always be linked to the central mechanisms to support the other systems as well. Another important component is that whatever is being generated, it should be helpful for the public health. It should be able to define the alerts, to understand, identify the alerts, and there should be a communication pathways with the public health authorities. In the document, we have to identify the risk communication mechanisms, the policy formulation, and the intervention planning. This is a key important area I keep on discussing with Vincent and Ashley as well. The legal ethics and the policy framework. This is the thing that when we were working, we were trying to identify that what are the current existing frameworks related to the wastewater surveillance. So wastewater management, there are certain policies and there are certain regulations, they do exist, but they are only limited to the clinical side or to the laboratory side. But for the wastewater side, there are other key elements that we have already discussed in our previous discussion and webinars as well, that needs to be well understood. And I'm really hopeful that that document will be really helpful for many of the countries to develop the legal framework, particularly for the wastewater surveillance. This is always suggested, go in a stepwise approach. Whenever we're in countries where there is no existing surveillance system, there's always suggested to go with the pilot study with few cities or few areas or regions to be identified. And then you can expand and scale up your activities based upon your experiences from the first pilot testing. Scale up and sustainability, just discussed with you that it's not only the scaling up to the different regions and the different provinces. The key approaches that you have to identify the constant donations or funding for the particular area. And this costing can only be done through engagement of the donors and the stakeholders. Always engage the local government to engage and to allocate the budgets towards this wastewater surveillance systems. Advocacy, capacity building, and communication are very key area. Whatever the findings that are being generated, they should be communicated to the stakeholders, to the public health, and it can be done in the form of a policy briefs. The dashboards can be developed. Already we are doing some kind of work on the dashboards, and this data can also be shared with the global platforms. And eventually the impact is always high when we share the findings and how this much is beneficial for the public health, for the control of the outbreaks, and how much we can save by spending on this wastewater systems. Finally, very important area, the monitoring and evaluation. Always define the KPIs, and then you can assess your system, that is it able to identify the relevant objectives that we have identified in the beginning. Always go for the reviews, the lesson learned, and then go towards a gradual expansion and the sustainability based upon your existing financing mechanisms. So with this, wrapping the whole discussion right now, we have discussed three main areas. Whenever we are building a holistic surveillance system, sustainability should be kept in mind. And the 5 key areas that we have discussed is the flexibility, the system should be equitable, it should be integrated, and all the activities that we are doing within the system, they should be actionable. The second, the stepwise approach, it is not different from the other approaches, but in the case of the wastewater system, there are certain key areas that needs to be identified that we have discussed in our previous slides. We have to assess, develop, implement, and finally, most important is evaluate. And then the important thing is that all the key elements that we have described within this strategic document, there needs an integrated and multi-sectoral commitment to develop through a stakeholder consensus. So with this, I come to the end of the presentation. Thank you so much. And if we have some questions, over to you, Vincent.
Thanks very much, Dr. Afreenish, for the very comprehensive sharing of the design considerations and parameters for national wastewater surveillance strategy. Maybe I'll just start off with one question before we try to address questions from one of the participants. You mentioned about building up sustainability require a multi-sectorial approach. I'm just wondering, based on your current experience so far, as we are trying to engage the different multi-sectors stakeholders, as you clearly has already highlighted that it's a long process for us to develop these national wastewater surveillance strategies. What would you think would be important to motivate the different stakeholders to continue to work on this path, these journeys, building up the national wastewater surveillance strategies for Pakistan? Assuming that there's not too many changes of key leaders in the different organizations, what would be the key factors that would be important to introduce or consider to motivate them to continue this journey, this potentially long journey? Thanks.
Vincent, a very relevant question. So when we started this work, we had the same kind of thoughts that how are we going to engage all the stakeholders, bring them on the one platform. But it's like in our country in particularly, we have a very huge history, a long history of the polio network that is happening. So there's already there's a kind of an understanding that there is something that is of really concern, and how much lives and how much cost can be saved by investing on this one approach. So there is already kind of an acceptance towards this kind of thing. And again, there are different stakeholders that you have already met in our meetings. They were there and they were doing the work in their own different areas. So when we talk to them, they are already helpful and supportive, that they want to collaborate and they want to establish something that is that can help beyond polio as well. So it's like when we initiated, we were just thinking to prioritize the pathogens that can be of interest to the different stakeholders, not only to the reference laboratories, but also for the public health actions. So that has created a good scenario that we have engaged all the stakeholders, give them the platform that it's signed something kind of a consultative process, and it cannot be done with the single person's approach. So something like group work, trust, this always helps to motivate them that needs to be done. And again, the biggest element is like we have engaged the provincial governments as well, and you have already seen the federal government and the provincial government. The main reason is for bringing them on board is that to make them aware, advocacy and awareness toward this particular area is very important. And just I have shown you in the slide that how much are we investing in the clinical side as compared to when we invest on the wastewater side, how much amount that we can save. Already, it seems a difficult business when we talk about the bioinformatics, the tools, the metagenomics, even the procurement is a huge, big task. But when we open the avenues, we give them a direction, we are supporting them, opening the channel that this can be done. So this is kind of a big motivation. Now, academia, industries, different stakeholders, they are talking to us that we have opened the avenues to them. We have shown them the pathways, the donors, the stakeholders, the procurement processes. And this is always helpful. This is always kind of a motivation for them that systems can be established, and we are always there to support them.
Thanks very much, Dr. Afreenish, for sharing your rationale and the factors that will be important for motivating the different stakeholders in different sectors to walk the journey together. So now back to the Q&A. There are a few questions, maybe in order of the questions. How do you think AMR and wastewater surveillance are correlated, and whether the strategies can be adopted to reduce AMR?
Okay, this is a question from Hasnan. Hasnan, it's like wastewater is kind of a very complex and a very beautiful area. I must say, it's not only the AMR thing it is targeting number of other areas. When we were developing the documents, Vincent, you remember, and you have shown in the slides as well, that how much this wastewater is helping towards the vaccine prevention strategies, towards drug development, towards the novel therapeutics. And AMR is one of the areas. So AMR, AMR is the biggest challenge. It's one of the biggest threat that particularly LMICs are facing. So definitely through the wastewater, we can identify the pathogens. We can identify their resistant genes. And we can identify that how much these resistant genes, they can impact the human health. In Pakistan in particular, I must want to add over here that typhoid is kind of a situation that in 2016, XDR typhoid, extensively drug-resistant strains of the Salmonella typhi, they started to emerge. And whatever is happening, it is happening in the wastewater, that it has acquired the resistant genes from E. coli from the wastewater, and then it has emerged. So wastewater, if we keep on monitoring it, it can be a very good marker to identify that whatever is happening with the microbes within the wastewater and how quickly they can adapt the mutations and how this much can impact the human health and eventually the public health interventions. So they are really closely related, and AMR is not just one area. There are other areas as well. But for our concern, AMR is like a biggest challenge. And we have already included this particular area in our surveillance structure as well.
Thanks for sharing. Maybe just a bit more on this AMR, aim to reduce, some of the burden using wastewater surveillance insights. How do you think this will, change the way how antibiotics is being prescribed, or in any way that AMR burden can be reduced from wastewater surveillance?
Yeah, Vincent, it's like we are doing the mapping or the sampling from particular areas, from the hotspot areas, and we keep on monitoring them. And side by side, we can have an eye on the epidemiological side, the clinical data from that particular catchment area. So if we're trying to correlate the two systems, that whatever we are seeing the wastewater from one particular catchment area, and we see the results from the same patients from that catchment area, so that can help us to understand. And very recently, Khan University, they have done a study on the vaccine efficacy for the Salmonella typhi. And this was a very long study, I guess 4 or 5 years long study. And they have tried to done the vaccination of the people for the typhoid. And then they were trying to identify the burden of the typhoid within the population. And there is some change as well. So this is a good example that the two systems, they can talk to each other. That on one side, you keep on monitoring the hotspots, and not only monitoring the hotspots, but sorry, also correlating with the clinical side, and do the public health interventions. If it is sewage elements that needs to be cleaned, or whatever the processes that need to be done, this needs to be done on the other side. And then you can see impact on the clinical side, or the outbreak side, or the clinical side as well. So the system should be talking to each other, and only then you can see the change of your surveillance and the monitoring systems.
Thank you. The next question, if I may, from the Q&A is, from your point of view, who should initiate this strategy?
Okay, so it depends. It varies from countries to countries. Like I can give you example of Pakistan. Like NIH works under Ministry of National Health Services Regulation and Coordinations. So that comes some kind of a mandate for us. During the time of the COVID-19 as well, NIH took the initiative, and we have done the wastewater surveillance for the COVID-19 along with the other partners. So the approach varies from countries to countries. And for a long-term sustainable approach, on a very bigger approaches, the government should be the one who is taking the lead. And the government institutions, they should be taking the lead, because they have the power, they have the authorization, they can connect, and they can further enhance the system as well. On one other angle, we can always leverage on the experiences from the academia, from other institutions. In our project, like we have a very good partnership with Khan University Hospital. So it's like we are already leveraging on their experiences. So it should not be a standalone. Someone should be identified to take the leadership, but the leadership should always leverage on the already existing systems.
That's great. Thank you. The next question, polio surveillance in Pakistan seems to be a very successful example of a nationally scaled program. Would this be sustained if we achieve polio eradication? And the second question is, are these wastewater data communicated to the public?
Would this be sustained if we achieve polio eradication?
Meaning to say, I think once polio eradication is achieved, is the polio environmental surveillance going to be stopped, and therefore may, affect or influence the national wastewater surveillance strategy?
Okay, very interesting. Like when we were, Vincent, you will totally recall when we were developing this kind of work.
Yes.
So we had this clear understanding that there's only one pathogen, that is one microbe, polio virus, that is being considered for the wastewater surveillance. But there are other pathogens of concern as well within the country. So we prioritize the pathogens. We talk beyond polio as well. And it's like we are in close contact with the polio team that is working in Pakistan, and we always learn from their experiences. So it's nothing like this that if that is eradicated and if this system can be sustainable. So it's like it goes all hand in hand. It's like polio is always supported by the other stakeholders, the government, by the WHO, and there's a huge interest because it's a global challenge right now. And for the other pathogens, it's kind of a national approach. And we always hopeful that this will definitely go in a sustainable approach. And the second is these wastewater data communicated to public. Yes, we plan for this. For the COVID-19, there are many publications. The data is already being reported to the public health leaders. And I totally recall there used to be a NCOC where the data is already being presented. And all the public health interventions, they were based upon all this wastewater data for the COVID that they were identifying. So we have good examples. And also for the other pathogen within the country, the same thing is being happened. So with this data as well, definitely we will talk towards the public health interventions.
Sounds good. Thanks, Afreenish. The next question is a bit interesting and also ties in quite well to one of the key priorities that we have highlighted from our dashboard mapping exercise, is that how to find financial support for this specific thematic. So I presume it's wastewater surveillance. And if you can share the different skills needed to have external collaborations.
Okay. Difficult questions, Vincent, I must
Yes.
say, because how we engaged with the Asia PGI and how we generated the funds. So it came from one source, and then we are trying to identify the other sources as well. But over the years, I think we have seen a little bit change towards this particular area. We can see that different stakeholders, that different funding agencies, they are coming up with this idea of funding in the wastewater surveillance. And we can share with you later on, there are different funding agencies that are supporting the wastewater surveillance. The biggest thing is in many of the lower middle income countries, the government, they have the other priorities, and it took a longer time for them to invest in this particular area. So this challenge or this time period can be covered by identifying the other funding resources. And now I can see that there are a number of funding agencies are there who are supporting these kind of initiatives, who are investing in this area, and they are always open to the collaborations. Yes, it needs a little effort. You have to write to them, talk to them, bring your right stakeholders on the table. And if there is a common interest, then you can see that there's funding that is happening. So it's a challenge, and Vincent can add more to it because he has more experience working with other countries as well.
Definitely, as Dr. Afreenish has mentioned, the engagement with the potential donors, philanthropies, needs to be a continuous one, and with a potential of joint collaborations between philanthropies as well as another model of a co-funding mechanism. So definitely there are increasingly more opportunities, as Dr. Afreenish highlighted, with the increase in interest in building up wastewater surveillance strategies as one of the global national surveillance strategies as part of the increase in the importance of regional health. And I think there's definitely a lot more engagements that we need to have with the academics as well as the private corporations as well to try to foster some form of public and private partnerships as well, to leverage on some of the limited resources that's available. For example, in terms of the development of detection technologies, extraction kits, I think there's definitely also opportunities for us to engage with the manufacturers to just justify and negotiate for better pricing to sustain the wastewater surveillance in low and middle income countries. So I think there are definitely a lot more efforts and work needs to be done as we move along this journey together. Yeah, thanks, Afreenish, for the opportunity to share a bit more. So, so there's one question. We need protocols of DNA extractions from wastewater. You can recommend a specific one, or do you think you can recommend a specific ones?
Exactly. We have identified the DNA extraction methods, and we can share with you. You can just write to us through the email, and my team can share the SOPs and the documents with you. And yes, we can already share. Yeah, we can share.
Yeah, just for info, the responses to these questions will be also uploaded onto our Asia PGI website. And I will ask and request Dr. Afreenish to maybe provide some recommendations on the FAQ documentations on our webpage. And we will share the presentation slides as well. And the next question is, You have mentioned that you are using a number of different sampling techniques for sample collection. Have you ever experienced Mu swab method for viral capture? And if you have experience, how about the effectiveness compared to the rest?
Yeah, exactly. We have not used it, but Khan, if Dr. Imran is around, he can definitely comment on this thing. When we have the discussions in-house, we have discussed about this Moore swab method, and one of our academic partners, they have used this method. And this is effective, no doubt, very cost effective and very easy to use method, and very less cost is engaged in this Moore swab. And this can be helpful when we talk about we're trying to save the cost. The other methods are there, the grab, composite, the nano trap, they are already there. And this always depends that whatever the funds that you have in your hands, and where best you can use. The Moore swab, as far as I can recall, they have shown that this has generated the good results. And definitely we can share we can get the answers from the other teams and we can share with you.
Yeah, definitely we can share that on our webpage as well as we compile the responses. The second last questions, I'm also mindful of time, 4 minutes left. Does NIH have started any project about wastewater surveillance system?
Yes, Asnan, we have initiated some of the work, and we hope to develop more robust and sustainable system through this pilot work that we are doing.
And the last question, if I may, is there a need to optimize extraction for every single pathogens?
A very technical question. My team can answer that, and definitely we can get back to it. And yes, there is you have to optimize because there are bacterial pathogen, viral, fungal. So for every pathogen, you'd have to identify the right extraction technique, and then you have to optimize based upon your lab skills as well.
Totally agree. And we shall provide you more information on our webpage as we compile the responses to all these questions. Okay, I think with that in mind, it has been a very fruitful and interesting sharing and discussion so far. Thanks very much, Dr. Afreenish, for your precious time and sharing. Hope to see you very soon again and the team. And thanks very much for the support for our Asia Pathogen Genomics Initiative and at Center for Outbreak Preparedness. Send my regards to all.
Thank you so much.
Yeah.
Thank you.
Thank you
Thank you,
everyone
Ashley.
for attending. Thank you. Look out for our slides and questions and responses on our webpage. Thank you.
Thank you.